Welcome everybody to today's session. Today is going to be on how to help someone who's contemplating suicide. Suicide is becoming an epidemic in our society, both for teens and adults. It is now the 10th leading cause of death in America. This is something that we need to understand, and we need to know how to help those that we love and care for avoid this tragic event. And I truly believe preventing suicide is possible. You have to know that someone who's contemplating suicide is experiencing extreme feelings of hopelessness, worthlessness, and feeling like they're trapped in absolute unbearable pain. And in their mind and in their mental state, suicide seems to be the only viable option. Now, you and I both know that that's not the case, that there is help and that there is hope. And if you know someone who is contemplating suicide or who has attempted in the past, please encourage them to watch my other video that's directed directly to those contemplating suicide. And I would encourage you to watch that as well so you can understand some of the things that I share with them. But again, today's video is going to be directed to those of you that may be put in a position to help someone who's thinking about suicide. I'm going to be going over 3 important aspects to understand. Those are going to be warning signs, risk factors, and then 3 things that you can specifically do when talking to this person who may be contemplating suicide. First, let's get to the warning signs. These warning signs are as follows. Talking about wanting to die or to kill themselves, looking for a way to kill themselves, like searching online or buying a gun, talking about feeling hopeless or having no reason to live, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious or agitated or behaving recklessly, sleeping too little or too much, withdrawing or isolating themselves, showing rage or talking about seeking revenge, or having extreme mood swings. Now again, these are just potential warning signs. Somebody may exhibit one or multiple of these, but be aware that these things can be serious warning signs and may precede someone having thoughts of suicide. Now let's get to some common risk factors that can precede suicidal thoughts and or attempts. Now, what is a risk factor? Risk factors are characteristics that will make it more likely for someone to think about, contemplate, and even attempt suicide. These risk factors include mental disorders, particular mood disorders, schizophrenia, anxiety disorders, and certain personality disorders, alcohol and other substance use disorders, hopelessness, impulsive and or aggressive tendencies, history of trauma or abuse, major physical illness, previous suicide attempts, family history of suicide, job or financial loss, and loss of relationships. Now again, these are risk factors. It doesn't mean that when someone has some of these things, they're gonna be guaranteed to be thinking about or attempt suicide. But it's important to know that these risk factors can increase the likelihood. Now let's talk about what if someone comes to you, or you strongly suspect someone that you love or care about is thinking about committing suicide. Now you will have found out about this by one of two ways. Either one, they've told you, or two, you ask them directly. Let's talk about what happens when they come to you and tell you. First and foremost, do your best to remain calm and empathetic and present with them. Overreacting can cause them to have more feelings of guilt and shame, and can confirm their feelings of feeling worthless or that living is not worth it. So try to do your best to remain calm. This doesn't mean you don't show emotion. Of course, you're human, you love them, you can show emotion, but do your best to remain calm. Because what I tell people all the time is that just because someone is thinking about suicide does not mean that they have a plan or that they even want to. Again, it just seems like the best option in their mind at that time. A lot of people think about or contemplate suicide more than you realize. And again, most people don't act on it. But the important thing is that we do take their thoughts and feelings seriously. We never want to minimize any thought or any statement of wanting to die or commit suicide. Now, that doesn't mean we're calling crisis team every time someone mentions this, but it means we get into a discussion and talk about it to see what is the next step. Maybe calling a crisis hotline or crisis team or even the police is necessary. But most often, what people need is a listening ear. And we'll get to that in a moment. But now let's talk about if you suspect someone is thinking about it or has developed a plan or whatever by, again, basis of warning signs and or the risk factors, then you may want to approach them and talk to them. You might initiate the conversation. And the best way to do this is just ask directly. You can say something to the effect of, are you thinking about suicide, or have you had thoughts about suicide and wanting to die? And again, you want to ask in a loving, empathetic, non-judgmental tone and manner. If they feel safe, they'll open up and talk to you. The next thing you can do is then what I say is love them. What does this mean? This means that you listen with the intent to understand what they're feeling and what they're experiencing. And then you want to validate those feelings. Now, by validating, I don't mean that you agree with or condone what they're doing. It means that you give them permission to feel what they're feeling. If they're feeling hopeless, or they're feeling trapped, or they're feeling a lot of pain, then validate those feelings. Let them know it's okay to feel that way, and that you want to understand and that you want to help. It is my experience that when people feel listened to, understood, and validated, then they feel loved. They feel that someone cares about them. But what can happen is that we can minimize their thoughts. We can even get scared and say something to the effect of, how could you dare think about that? That's so selfish. Or don't you even care about what we would think or feel? We make it about us. It's not about us. It's about them. And we need to be there with them in that moment. So take a deep breath and be present with them. Listen, understand, and validate them. That will go a long way, I promise, as opposed to the other. The final thing that you can do is encourage them to tell someone that can give them more tools and more skills. Again, if they're a teenager, maybe they can talk to a guidance counselor or a school social worker or a professional counselor. If they're an adult, encourage them to seek counseling and to seek help. Suicide is an important and delicate matter, and I strongly encouraging them to seek professional help any way that they can. And if all else fails, they can call the national hotline number that's provided here on the screen, and you can give this number to them as well, and they can talk to somebody that has the skills and the tools to really work through it with them in that moment. So again, there are some things that you can do. Know the warning signs, know the risk factors, and be willing to listen to them and empathize with them and encourage them to seek help and talk to a trained professional. Again, my message to you today is that it is fairly normal for people when life is going not their way to have thoughts of suicide. Many people do. Perhaps you have in your life. Now, maybe you weren't willing to act on it or had no desire to, but still, many of us have had those thoughts. Be compassionate, be understanding, and be a listening ear. I hope this was helpful. If it was, please comment in the comments section below and let me know what you found the most helpful, or just that it was. Say, very helpful, thank you. Please share it with someone else or anybody you know, because we all may know someone that's struggling with this issue. Until next time, make it a great day and make it a great week.